Hey folks, Dr. Jeff Williams with Creekstone here in Amarillo, Texas, and your host of Chiropractic Forward podcast, back with another episode. This week, we're going to discuss headaches. It's common for people to look at chiropractors as spine people and back doctors. But what people don't commonly know is that chiropractors can knock it straight out of the park when it comes to treating headaches. Yes, I said knock it out of the park. And so for you that don't know, that's an old metaphor that comparing baseball players hitting home runs. And I'm telling you, chiropractors mostly hit home runs on headache cases. I got to admit, though, I was a terrible baseball player. I played college football, and I'm Texan born and raised where football is king, so I should probably put it in football terms that makes sense. In football terms, you may say that we chiropractors, we've got a record of 80-yard touchdown passes when it comes to headaches. We dance in the end zone and spike it. We return headache punts for a score almost every time. I don't know what a headache punt is, but we pick six those suckers. Yeah, that's for the hardcore football fans. Not everybody knows what a pick six is, but we pick six those headaches. So that's probably enough to drive home the point. Not every single headache, of course. I've met my match several times over my 20 years in practice, but I don't think it's too bold to say that about 80 to 90% of headache patients just improve. And really not just improve, but dramatically improve. They just get better, way better. Before we get into the research, let me take a minute to give you just a couple of personal experiences in treating headache patients in my practice here in Amarillo. Case number one, we're going to call this patient Andy McFuddlesticks, just because I'm feeling a little goofy this morning. And that sounds a little like a Harry Potter character. I know this. My family, we're kind of Harry Potter nerds, but don't tell anybody. Andy had experienced migraines his whole life and was around 40 years old at the time that we crossed paths. And he had been to all the medical doctors. He had gone through the injections in the suboccipital region. I don't recall what the injection was exactly. This was like 18 years ago. I don't believe they were doing Botox for migraines at that point in time. But he had gone through nuclear bone scans, all kinds of stuff. Boy, he had really been through it. He came to see me only a few times, and it was frustrating that he didn't finish his treatment plan. But the reason he didn't finish is pretty satisfying. Andy only came a handful of times because the headaches were gone. After all the years and procedures, just a few visits to a very new and very green chiropractor made him go away. Now, how do I know that? Well, I was in a civic organization with his brother who confirmed months later that his brother was doing great and had not one headache since he came to see me. How is Andy 18 years later? Well, I have no idea. I switched towns, but I know he did great for a long time. And we're putting that one up in the win column. I think it's common that when folks have a long history of headaches, with no treatment at all, they're likely to come back. But I think that showing how well he did with a little bit of chiropractic treatment, he was probably able to go to another and keep those under control. That's my hope anyways. Case number two, Sally McGullicuddy. Not her real name. Red hair, Irish. Not really. Anyway, Sally had migraines for years. I actually knew Sally personally and had been friends with her for some time. Evidently, I was not skilled at getting my message out on how successfully we chiropractors can deal with headaches, because it took Sally way longer than it should have taken her to make an appointment with us. Sally shared with me that she had migraines on average several times a week, and once or twice every month she'd find herself in a dark bathroom floor, sitting by the toilet, throwing up. And how awful of an existence is that? I can't even imagine being forced to live that way. I say it pretty often, but it bears repeating. Pain can absolutely change a person. Not only the person, but can it change everyone around the person who's, consistently in and out of contact with them? Absolutely it does. Pain changes people, and it changes the relationships they have because it changes everybody's attitudes. So after approximately 2 to 4 weeks of working with Sally, she just started to not have the migraines anymore. Isn't that awesome? I would say she magically recovered, but chiropractors, we know this isn't accurate. We got the right joints moving, we got the right muscles to relax, and we got out of the way and let the body do the rest. There's no magic in that brew. There's no magic there. It's just common sense to chiropractors. Fast forward a few years, and Sally's still a patient. Sally comes here for other reasons and conditions from time to time, but she doesn't visit because of migraines anymore. She just doesn't have them. I could absolutely go on and on with examples from personal experience here in my office. I have 20 years of dealing with headaches, and I can tell you, chiropractors are basically modern day headache whisperers. Let's dive into a little research just to show you exactly what I'm talking about here. There are more papers we'll go over in the future, but I want to touch on 2 this week. One new study, one a little bit older. The first one is the more recent research paper and comes to us from a group in Spain. The lead author was Miguel Malo-Urias, PT, PhD, with the University of Zaragoza, Aragon, Spain, and it was published in the Journal of Manipulative and Physiological Therapeutics in the November-December 2017 issue, Volume 40, Issue 9, pages 649 through 658. The study was titled Immediate Effects of Upper Cervical Translatoric Mobilization on Cervical Mobility and Pressure Pain Threshold in Patients with Cervicogenic Headache, a randomized controlled trial. I'm telling you, what a name, wouldn't you agree? These folks, they got to shorten these names. It's amazing. Did you catch that word though? Translatoric. Well, I'm going to define that for you. Translatoric is not commonly in the chiropractic verbiage or vernacular. At least I don't recall it from my education at Parker University there in Dallas. But that was eons ago. Things may have changed. I don't think it has. I have gray sideburns now. It's been a while, but the authors of the paper all have PT behind their names. So we have basically physical therapists setting the terms for the research project. Understanding this, then the use of translatoric makes more sense. I found a site that gives a pretty good definition of translatoric spinal manipulation. The term translatoric spinal manipulation, or TSM, consists of a series of high and low velocity manipulative spinal techniques which emphasize the use of small amplitude, straight line, or translatoric, traction, and gliding impulses delivered parallel or perpendicular to an individual vertebral joint or movement segment. Furthermore, TSM emphasizes the use of either direct manual stabilization or the use of spinal prepositioning to restrict the amount of motion occurring at adjacent spinal segments during the translatoric impulse. The website goes on to say delivering translatoric impulses, as in maybe the form of disc traction or disc glides or facet traction or facet gliding, delivering that to an individual joint or spinal motion segment while using stabilization provides the manual therapist with a manipulative tool that has a predictable effect in terms of pain reduction and pain restoration with minimal potential risk of patient injury. Do you know what that sounds like to me? That sounds like a really long, very difficult way of saying it's a chiropractic adjustment. Another term it sounds like is spinal manipulative treatment. Something we chiropractors have been doing for over 100 years and have been called crazies and quacks for doing. It sounds like the exact thing that the medical world has blamed as being responsible for strokes. But in this, they say it's a very minimal risk, which we knew. When they talk about it being such a tie-in to strokes and such, they have absolutely no idea what they're talking about. But this translatoric spinal manipulation basically is nothing more than a chiropractic adjustment. Now that we got that out of the way, let's dive into the research. Here's why they did it. The good folks in Spain performing translatoric spinal manipulation rather than chiropractic adjustments wish to assess the response in terms of range of motion and pain in patients suffering from cervicogenic headaches. Now here's how they did it. The paper included 82 patients. The patients ranged in age from about 25 to 55 or so. All patients suffered from cervicogenic headaches. The patients were randomly split up into two groups. One was a control group and one was a treatment group. The treatment group received chiropractic adjustments. I'm sorry. Excuse me. I wasn't thinking. The patients didn't receive chiropractic adjustments. I'm sorry. They received translatoric spinal manipulation. The control group received no treatment or sham treatment. The researchers tested cervical range of motion. They tested the pressure pain thresholds over the upper trapezius muscles, the C2, C3 zygapophyseal joints and suboccipital muscles were tested, and the current headache intensity were all measured with the visual analog scale prior to the chiropractic adjustment, translatoric spinal manipulation, and right after the TSM. The testing was done by two blinded investigators. What they found was afterwards the chiropractic adjustment group, the translatoric spinal manipulation group had significantly increased range of motion in the neck region overall, as well as in the flexion rotation testing. And while there was no changes in the pain thresholds, patients reported significantly lower intensity in their headaches, and that's cool. So let's wrap it up. The quote from the authors themselves reads as follows. Upper cervical translatoric spinal mobilization intervention, chiropractic adjustment, increased upper and exhibited a tendency to improve general cervical range of motion and induce immediate headache relief in subjects with cervicogenic headache. Now, there you have it, straight from physical therapists, PhDs performing chiropractic adjustments but calling it something else. I want to be honest here. The frustrating part of this isn't necessarily the fact that PTs are doing cervical chiropractic adjustments. Heck, chiropractors, we've been doing PT for years, but the physical therapists claim ownership of that term, so the chiropractic industry simply just calls it exercise rehab. So I guess turnabout is fair play, right? Although they're doing adjustments may be irritating on some level, the most irritating thing is that a certain aspect of the physical therapy community and a larger aspect of the medical community has spent years ridiculing, mocking, and belittling generations of chiropractors. And now, doctors of osteopathy and physical therapists are trying to do the exact same thing without going through any chiropractic training. You'd think they would at least release a statement saying, we've thrown rocks at chiropractors for years, but it turns out they were right all along. Since we can't beat them, I guess we'll join them. Release a statement like that. Wouldn't that be refreshing? Now, let's go over the older study before I start getting too ugly about the whole deal. This one is by G.V. Espilopez et al. And is called Do Manual Therapy Techniques Have a Positive Effect on Quality of Life in People with Tension-Type Headaches? A randomized controlled trial. It was published in the European Journal of Physical and Rehabilitation Medicine on February 29th of 2016, and here's why they did it. Although there have been lots of studies that prove the impact of manual therapy and spinal mobilization for frequency and intensity of pain suffered from tension-type headaches, there's been no studies in regards to the effectiveness of the same therapies for quality of life for the people suffering from them. The authors of this paper wished to focus on patient quality of life. Here's how they did it. The study was a randomized, single-blinded, controlled clinical trial comprised of 62 women and 14 men. They were aged 65 years old all the way down to 18. All subjects suffered from chronic tension-type headaches or episodic tension-type headaches. The subjects were categorized into 4 separate groups: suboccipital inhibitory pressure, suboccipital spinal manipulation, a combination of the two together, and then there was a control group. An SF-12 questionnaire was used to help assess the subject's quality of life at both the beginning of treatment, the ending of treatment, as well as at the 1-month follow-up. And here's what they found. The suboccipital inhibition group improved significantly in their quality of life at the 1-month mark, as well as improvements in moderate physical activities. Not the control group, but all other treatment groups had an improvement in physical activities, pain, and social functioning at the 1-month mark. After treatment, as well as at the 1-month mark, the combined treatment category had improved vitality. Following treatment and at the 1-month mark, both groups that had manipulation to the suboccipital region also showed improved mental health. So to wrap it up, make sense out of that. All 3 therapy approaches showed significant effectiveness toward improving the quality of life. However, the combined treatment therapy had the most dramatic change for the group. In short, manual therapy techniques and manipulation applied to the suboccipital region for 4 weeks or more showed great improvement and in effectiveness for several aspects that measure the quality of life of a patient having suffered from tension-type headaches. And that's just another reason to call a chiropractor today. Research and clinical experience shows that in about 80 to 90% of headaches, neck and back pain, in comparison to the traditional medical model, patients get good or excellent results with chiropractic. Chiropractic care is safe, it's more cost effective, it decreases your chances of having surgery, and it reduces your chances of becoming disabled. We do this conservatively and non-surgically. In addition, we can do it with minimal time requirements and minimal hassle on part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, we can likely keep it that way while raising the general overall level of health. So please feel free to leave a comment. Tell me your thoughts. I'd love to hear what you think. And remember, sharing is caring. Share. We can't make a difference without your help. Be sure to find us on social media sites like Facebook, Twitter, Google+, Pinterest, LinkedIn, Snapchat, and Instagram. Also, be sure to subscribe to our YouTube channel. The link is in the description, or hit the big red subscribe button below. It's really that easy. At the very least, can we talk you into giving us a thumbs up? A gesture that simple and quick really helps us to get in front of more people looking for this kind of information. Be on the lookout for our new podcast called Chiropractic Forward. It's ready. It's up and running. You can find it. Till next time, thanks for watching. Thanks for your interest. Thanks for sharing. Tell somebody, and we'll see you next time.